My name is David Rowlands and I'm one of the equine vets here at Penbode, and I'd like to welcome you to our first ever virtual client evening. It is our first, so please bear with us if we have any technical glitches. We do live in Devon, not renowned for the best internet coverage. Before we start, I've got a few items of housekeeping. The fire exit is through the door behind you. No fire drill is planned, so if the person next to you shouts fire, there is a fire. The toilets are located in your bathroom. There is free food and drink all night, so please feel free to get up at any point and go to your fridge. And finally, of course, champagne will be served at the end of the evening. Tonight, we have two presentations for you. Firstly, Kieran O'Brien will speak about equine lumps and bumps. And then I will give a short presentation on how we are using our new state-of-the-art laser diode to remove sarcoids and melanomas from horses. There will be time for questions at the end. I see some of you have already been using the chat function at the bottom of your screen. Feel free to post any questions and we'll do our best to answer as many as possible at the end. I hope that you all enjoy your evening, and now I'll hand over to my colleague, Kieran O'Brien.
Yes, hello everybody, I hope you can hear me. Thank you for joining us tonight. My presentation is essentially an overview of lumps and bumps. It's a bit of a generic term, so I'm just going to put my screen up and hopefully you will be able to see what I can see. I'm going to go to the first slide. So there we go, lumps and bumps, very much a generic term. Just a quick overview of the horse's skin before we start into the main causes of lumps and bumps. You've got a very thin layer on the outside called the epidermis. The hair comes through the epidermis. It's basically growing from below the dermis, which is the bulk of the skin. And if you look here, these are hair shafts, and they're at an angle, and then there's this muscle here which will contract when the horse is cold and lift the hair and help to trap some air under the hair. Also here we've got sebaceous glands, which is secreting an oily secretion onto the hair. This is an important part of waterproofing the hair for the horse. And of course, if you shampoo the horse, you remove the oily layer, so you severely limit its waterproofing. We got blood vessels, very thin blood vessels going right into the skin. And remember that when you put cold water on a horse to cool it, you're not cooling directly through the skin to the underlying tissues. What you're actually doing is cooling the blood that's flowing through the skin, and that then takes the cooling to the rest of the body, into the muscles and to the main organs. We've got sweat glands here, which are discharging onto the surface, and they're obviously an important role in cooling as well. Now, so skin lumps, as I say, it's a very generic term. I mean, all kinds of things cause lumps. We've got areas of trauma, we've got scars, horse bites, horses biting each other, usually on the neck. Sometimes they resolve quickly, other times they need treatment or leave a scar. Fly bites, obviously extremely important. There are a lot of allergic reactions. The horse's skin is highly reactive. It's very much an individual thing. Nodules are common in the horse's skin. And then, of course, we get to the really important ones, which I'm going to concentrate on tonight, which are skin cancer, which includes sarcoids and melanomas. Now, fly bites, you've all seen these, variable size, tend to be fairly transient. Horseflies, when they bite, they inject 3 separate substances, one to increase the blood flow, one to cause tissue damage, and one to prevent blood clotting. So they're very sophisticated animals producing these substances, and it's not surprising that we get a fairly marked reaction from horse bites, but they usually disappear without treatment within 24 hours, so we don't worry too much about fly bites. Then we have the group of skin reactions that are allergic reactions. We've got these mast cells sitting in the skin, sitting in the dermis, and the horse reacts to something, produces antibodies. The antibodies attach to these mast cells. These mast cells are full of histamine and other inflammatory mediators. And then the antigen comes along, whatever the horse is allergic to, joins these antibodies together, ruptures the cell, and releases the contents. So this would be histamine and other inflammatory things. So this would be classical in a sweet situation. The fleece, the midge saliva contains these protein antigens to which the horse is sensitized, and releases histamine into the skin and causes the itching and irritation and swelling. So these are some allergic reactions. On this horse's shoulder, you can see he's reacted to something, probably something maybe on the tack, maybe some type of saddle soap, some sort of grooming spray, something like that. This is more severe in the saddle area. This horse has got lots of lumps, but quite small. Now this horse here was washed with car shampoo, and you can see here in the saddle area exactly where the shampoo was applied. You got this beautiful pattern exactly where it's applied, because the horse was allergic to some substance in that. This is another horse. This fly gel was applied to this horse, and it's reacted exactly where it was applied. So these horses have got some unique sensitivity to these substances, and they will retain that for life. Now, sometimes we see the whole horse involved in the allergic reaction, and we get these wheals in the skin. Sometimes you get these circular ones, which are called collarettes, with a little kind of hollow. Sometimes we can find the trigger for these, sometimes we can't. They can be quite dramatic. You can see in this horse here, his eyes are swollen, the muzzle's swollen. But very often, actually, if the head is not involved, the horse isn't particularly bothered, although it looks very dramatic to us. So these are generally called heat bumps. They suddenly appear, variable size and number. We tend to see them on the trunk mainly, also on the neck. And usually if you touch them, the horse doesn't object, and they're not usually itchy. If they're there for more than a few days, they sometimes start to weep. And sometimes there's an obvious trigger, but often there isn't. And the sort of triggers that could cause these would be things like dietary constituents. I've seen garlic cause this, different supplements, medications, some of the drugs we use, some of the antibiotics can trigger this reaction, anti-colic drugs, and it's a very much an individual thing. And it's worth remembering that if your horse reacts to any of these medications, it's really important that you tell us when we come to treat the horse that it's got these sensitivities, and you make a note on the passport about them in case you sell the horse, and they know. They can be inhaled, they can be in contact allergies. I've seen this with paper bedding, where horses developed all these wheals under the belly. It was pretty obvious that that was a contact allergy, and it was paper bedding, fly sprays, all this sort of thing. So what do we do about them? Well, if they're mild, very often they will self-cure. We try to remove all possible allergens. So we would put the horse on a basic diet, hay only, bring it indoors in case it's something in the field. Sometimes we give them a steroid injection, or maybe we give them a course. Some of the difficult cases can last for up to 3 months before they resolve. We put them on medication, they go away, we take them off the medication, the lumps come back. And sometimes it can be extremely difficult to determine what's triggering these allergic reactions. And sometimes we have to go to skin testing, which is a way of where we inject large numbers of potential allergens and see if the horse reacts at the site of injection. If we suspect it's feed, what we would do is we'd put the horse on a very basic diet, hay and water for probably 2 weeks, and then challenge it with what we think might have triggered it. Now, then we get nodular skin disease, and these are these small, hard nodules, usually in the saddle area. I very commonly find these at vettings, pre-purchase vettings, very often just a small number, sometimes towards the back of the saddle area. This is a more severely affected horse. This was actually at a vetting. But if I touch those, they're completely painless, they're hard, the hair is normal above them. Now, you could argue that this horse has got very little muscle development here, so getting a saddle to fit this horse is going to be a bit of a nightmare. And you could argue that maybe pressure has caused these, but actually they're all over the side of his trunk, and in fact they were on his neck as well. So they're very common, nodular skin disease. The correct name are collagenolytic granulomas. We don't know the cause. If you take them out and look them under the microscope, they have got cells in there called eosinophils, which we tend to see as in allergic situations. I don't think they're caused by bites, because we see them in summer in horses wearing fly rugs. So I think there's something else. We don't know the cause. By and large, we don't remove them surgically because it's an area where generally where there's very, very little loose skin. So the horse has got to reconstruct the skin over where the lump was, and that can take weeks, if not months. So the question, do we treat them? First thing we do, are they painful? So I just press my finger on them, move them around, see if the horse objects. Are they ulcerated? Are they having some interference with tack, for example, if there's pressure on them? And how recent are they? Because they can become calcified and can persist for the life of the horse. And sometimes when I find them with a pre-purchase vetting, they may, and I ask the seller, how long have they been there? Sometimes they've been there for years. And those are the treatment options then, is to do nothing because they're not very significant. You've only got a few. We can give them steroids. Some cases, if they're causing an issue, particularly with tack contact, we can inject steroids directly into them. We have to use a high pressure injector because they're very, very dense. And as a last resort, they can be removed surgically. Then I get on to the really main part of my talk tonight, which is skin cancer. And sarcoids are by far the most important. Melanomas, of course, are a problem with grey horses. Other skin tumours we do see. They're not very common, thank goodness. But sarcoids are the number one type of skin cancer that we see. And I think a very good rule of thumb to remember is that all lumps without hair on a horse's skin are sarcoids until proven otherwise. And if you remember that rule of thumb, that's quite a good one. And you'll be right most of the time. Now, clearly that excludes melanomas. They haven't got hair on them. But I think that's a good general rule of thumb. So sarcoids are a form of skin cancer. And they tend to appear or grow on areas of the skin with very little hair where horses sweat. So typically around the sheath, between the hind legs, sometimes along the ventral abdomen. And there are 5 types of sarcoids, and I'll go through them in a minute. And if we look in these sarcoids, we can see there's a cattle virus present, or at least the DNA is present. We don't quite understand what is happening here, because if you try and extract the virus from these sarcoids, you can't do so, although you can demonstrate the genome is there. And if you put this virus into horses experimentally, they mount an immune response and get rid of the virus and don't get sarcoids. So we don't quite understand what the full story is here, but what we can say is they are definitely spread by flies. And here you can see a fly. This is an occult sarcoid just on a horse's face. This is the eye here. And this fly is feeding in this region here. And then on this slide on the right, you can see these are sarcoids that have been almost certainly seeded by a biting fly. And one fly we think that's very important in these is Stomoxys calcitrans, which is the stable fly. These are the flies that bite you on your legs in the stables and bite horses in stables, and they almost entirely live indoors. And they bite anywhere on the horse's body they can get access to. And almost certainly what's happening here is this fly, or maybe several flies, have started transmitting sarcoids through their bites. So, in other words, while we think about sarcoids being spread by flies, and we think about flies as an outdoor problem, they could just as easily be spread by indoor flies. And we've got to be, fly control is quite important in dealing with sarcoids, as well as treating the actual sarcoids themselves. Now, we know there is a genetic susceptibility, and this susceptibility runs in families. In other words, there are horses that are naturally resistant because they haven't got the relevant genes. In fact, probably 50% of horses haven't got the genes. And certain breeds, for example, Lipizzaners, purebred Lipizzaners, never get sarcoids because they haven't got the relevant genes. They're very unpredictable in that they can grow or they can stay quiet for a few years and then suddenly start growing. They can be quite aggressive locally. By that I mean they can be quite invasive and invade deep down into the dermis, although they rarely become malignant in the sense that other tumors become malignant. In other words, they don't spread around the body, but they can spread from their original sites. And fortunately, the malignant form is quite rare. Now, I've seen very few cases, but it's virtually untreatable. It's a horrible, nasty condition. And another argument for treating sarcoids early. Now, the other thing is that they can self-cure. We don't quite understand why that happens. I'm going to talk a little bit more in detail about that, but it certainly does occur. And you think, well, if they self-cured by mounting an immune response, why didn't they mount the immune response in the first instance and not get the sarcoid in the first place? So this is a bit of an unknown question. And obviously, there is an aversion to buying horses with sarcoids, so there is sale and insurance implications, but I'm going to deal with that a little bit later. So let me show you this type of sarcoids that we see. Now, these are the type 1, which are the occult sort. So if you look at this horse's muzzle, you get this sort of strange, hairless, slightly sort of leathery area. Around this eye here on the lower left, you can see here there's an area, I'm just outlining it now with the mouse, where there's very thin, very little hair growing, sort of scaly, completely smooth. So that's an occult sarcoid. Now this one's inside a hind leg, and you can see here the hair is very thinned. Of course, there is a large vein here, which would make treating this very tricky. And we'd have to consider the possibility of significant bleeding. But my colleague David will deal with that later on. And then we get to the second type, which are the varicose sort. And these are these sort of leathery ones, which are sort of raised, rough surface. And this is another one here. It's kind of lumpy, scaly sort of appearance. Now this is down here. This one here is a mixture of two sarcoids. This is an occult surrounded by a varicose center. So here it is. So you got this occult area around, which is just slightly abnormal, sort of leathery skin, but then we get this sort of crusty, lumpy area in the center. The nodular sarcoids, a lot of you will have seen these. They can occur anywhere in the body, commonly in the sheath region and in the groin region. So here's one here. Sometimes the skin overlying them is completely normal. Other times it's ulcerated and attached to the nodule itself. Here's another one here. This is in a grey horse, but it is actually a sarcoid. It's not an adenoma. And here's a cluster of them here in this horse inside the hind legs. Another one here, several here. So that's so those are nodular sarcoids. And then we get the more aggressive sort, which are the fibroblastic ones, which almost look like a lump of proud flesh. Now this here is on the girth area, which is of major significance for this horse because he probably can't wear a girth, so that would have to be treated. They're quite fast growing, very aggressive, very invasive. They are the sort of nasty ones, and they it's really important that they're treated, particularly if they're in an area of contact. Here's another one. This is on the ventral abdomen. Now this one here, very unusual site, almost certainly has been implanted by a fly, possibly on a wound, a fly feeding on a wound in that region. And sarcoids growing in wounds are surprisingly common. Obviously that, has been left to grow and should have been treated a lot earlier, but that's the fibroblastic sort. And one other thing about fibroblastic sarcoids is that if we treat one of the other sorts, one of the more benign sorts, and the treatment fails or is incomplete, they will often come back as this more aggressive sort. So as I'll explain later, when you treat sarcoids, your first shot should be your best shot. You only want to treat it once. They commonly occur around the eyes, and that could be maybe because flies are attracted to horses' eyes. So here's one. This is a nodular sarcoid, fairly close to the eye. This one's right on the eyelid. This one we removed with our laser and did very well. Now here's a much more complicated one. So we've got a big occult area, probably a nodular sarcoid here. So this would be extremely difficult to treat, and that might be one we might treat with radiation therapy. Of course, if you let them get out of control, you end up with these, what I call sarcoid disasters. So here's one here, multiple sarcoids all over the abdomen. I mean, there are lots more on this horse that I haven't shown you. These didn't start like that. They just weren't treated and they were allowed to get out of control. So you've got a fibroblastic one growing here. In fact, most of them are fibroblastic. So very, very difficult to treat once they get to that stage. Here's another one. This is a horse lying on its back on the operation table. And there's its udder there. And here are these very aggressive, invasive sarcoids, deep roots. Once again, trying to treat these can be very difficult at this stage. Now here's another one, a very big sarcoid growing. This is a horse's stifle. Very invasive, delayed treatment again. This is another one. This had been treated with Thuja cream, which is a sort of a homeopathic thing, completely failed. And now look at the size of it. Luckily, it's on a fairly narrow stalk, so removing that surgically wasn't that difficult, and it hadn't invaded too much. Very often, by the time they get to this size, they've developed a very extensive root, and can be very difficult to treat, because when you treat them, it's vitally important that you remove every single sarcoid cell, including in the root. So if you've got a sarcoid, what are you going to do? Well, a very good rule of thumb is the fewer it has, the fewer it will get. So there's a compelling argument for treating them when the horse has only got one or two, rather than wait for them to grow or develop more. Some of them sit quietly for years, like the very close and occult ones. But do ask our advice, because we're seeing these every day of the week, and we can tell you which ones we think should be operated on, which ones can be left, and so on. And don't rely on the famous Karen on Facebook. But if the horse has got more than one, or particularly if they're in an area of attack contact or close to the eyes, or they look aggressive, you must treat. But remember that the treatment regime must be carefully chosen. One size does not fit all. It can be prolonged, it can be expensive, because it may require multiple applications. And remember that if any interference with a sarcoid tends to make it grow more aggressively. So, for example, we rarely biopsy sarcoids if we can possibly avoid it, because often that'll stir them up and they'll start growing rapidly. So if we ever have to biopsy them, we have to have a plan as to what we're going to do with them, that we've got to put into action straight away once we get the result. And remember that, like all these things, treatment is more successful if you get at them when they're early. All big sarcoids start out as small sarcoids. That's when they should be treated. And for some reason, although they're not common in young horses, young horses seem to respond a lot better. Now, of course, we do have problems, because collateral damage, as I mentioned, it is very close to the eye. And the eye is a very delicate structure, very easily damaged by any kind of chemical applications. So we have to think very carefully how we would treat that. This one is very close. So my finger here is here on the stifle joint. This is very close to the stifle. It's actually quite a deep-rooted fibroblastic sarcoid. So there could be a risk of joint penetration to remove that. And if they're close to a large blood vessel, there might be a problem with bleeding. Now, incomplete treatment is always a big problem, because they, as I say, they tend to regrow in a more aggressive form. And regrowth can occur up to 10 years after treatment. So although a sarcoid has apparently been successfully treated and left a scar, it can always come back. And it can come back anytime up to 10 years later. Now, these are very tricky ones because of their location. So we got one here on the fetlock joint. There it is growing there. Almost certainly this horse had a small wound there, and a sarcoid was probably implanted by a fly. Very easy to mistake that for a little bit of proud flesh, but it's not. It's a sarcoid, and if we treat it for proud flesh, it will not get better. In fact, if anything, it'll get worse. So that's right on the fetlock joint, and that one was actually treated by radiation therapy. Here's one growing on the coronary band. Once again, almost certainly implanted at the site of an injury, a tread injury. That's almost certainly the inside of the hoof, and the horse has trodden on it with the other front leg. So once again, a risk of damaging the coronary band. This one down here, very difficult one to treat. It's treatable, but you can see the size of it and how close it is to the eye. But remember, that started out as a very small sarcoid. Here's one on the ear. We treated this with a laser quite successfully, but it's been there a long time and has started to invade the ear itself. So these are all tricky ones that will cause problems for us treating them. And they're a good example of why you need professional, experienced advice with sarcoids, and don't start treating them yourselves based on things that you've read online or people have told you to do. So what sort of treatments are there? Well, removing them surgically sounds attractive, just take it off and put a few stitches in there. But there is quite a high rate of regrowth, because it's very easy to seed the surrounding area with sarcoid cells. And there's about a 50% regrowth rate on average from surgical removal. So we don't do it very much. Banding is fairly successful if you choose the right ones, but of course the band does not include the root. So as I'll show you in a moment, it's best to band them, but also to use an injectable chemotherapy at the same time, which will go through the band and kill the root. Caustic applications, a lot of the traditional sarcoid remedies were actually just simply burnt them off. Various arsenic preparations. Bloodroot is a caustic. It's got nothing profound. All it does is just kill every cell that it goes on. Cryotherapy, that's when they are sprayed with liquid nitrogen, was very popular in the 80s when it was first introduced, 80s and early 90s, but it's kind of fallen into disuse because there was quite a high regrowth rate. We still do it occasionally, but where we've got difficult ones, but there is a regrowth rate. Laser excision is the more modern approach, and my colleague David will describe that to you later. Chemotherapy, we can apply topically. Many of you will have heard of the Liverpool cream, which contains various anti-cancer drugs and some heavy metals. Or some, we use an injectable chemotherapy. These are drugs similar to the ones we use, are used to treat cancer in people. Immunotherapy, it can be quite successful using the BCG vaccine. This is the human tuberculosis vaccine. That can be quite successful in sarcoids in difficult places. Works very well around the eyes particularly, but tends to make things worse on the limbs, sarcoids on the limbs. Nobody can explain why that would be. Radiation is used because that's a sort of non-invasive treatment. And then, of course, there are all kinds of alternative treatments that you will have heard of. So here are some, these are nodular sarcoids. They got a little bit ulcerated. They've been banded. But of course, I'm not dealing with the root here. I'm just dealing with the sarcoids themselves. And some of these might have a significant root, and therefore there's a high risk of regrowth. Now, this one down here, excuse me, I've banded it, but I've also injected some chemotherapy into the sarcoid, which has traveled into the root and given us a much wider area of treatment. So that whole thing will come away, there's far more likely to have got rid of the root in that one rather than just simple banding. I mean, people are very tempted to do their own banding, but you do run the risk of leaving the root behind. And as I said before, any interference tends to make it more aggressive, so it won't come back as a nodular sarcoid. It'll come back as a nasty fibroblastic sarcoid. So that's not good. Now here's topical chemotherapy. So here's one growing inside the forearm. This is in the axilla, in the armpit. Very difficult site, and commonly we get sarcoids here. And there tends to be quite high risk of regrowth in this region. We don't quite know why. So this is the same sarcoid. Topical chemotherapy has been applied directly on the surface, but it has kind of leached into the surrounding area, which in a way you want to do that, so you get all the residual cells, and that will eventually separate around the edge and detach it and come away, but it'll take months. So all these approaches are very slow and quite involved to do. Now here is another one on a horse's neck. This is an occult with various different sorts, probably fibroblastic ones. And we've treated the whole thing with chemotherapy, and it's formed this kind of hard, sort of fibrous lump, which did eventually detach, although it took 5 months to do so. So very, very effective, but very slow. And of course, always a risk of further spread when they take so long to come away. Now, this is a very nasty case I treated. This I treated with BCG vaccine. It had multiple injections directly into the tumors, quite expensive because it requires a lot of treatment, but very, very good result. And luckily we had no regrowth. Now, what about all the alternative treatments? Well, there are loads of them. If you Google treatment of sarcoids, you will see multiple references to thuja. Toothpaste had a great vogue about 10 years ago. Bloodroot ointment, turmeric, burnt toast, yes, believe me, yes, there was a vogue for that. All kinds of things. And the question is, do they work? Because how do you assess whether they've worked or not when we know that there is a self-cure rate? So this is where I think we have to apply what I call the licorice all sorts principle. Now, if I had a really, really bad cold and I took 2 licorice all sorts every day for 2 weeks, And after 2 weeks, I felt absolutely great. Can I say those licorice oil salts cured my cold? No, of course I can't. You'll say, don't be ridiculous. It's a coincidence. But if instead I took a very interesting substance like turmeric, and after 2 weeks I felt great, people might say, oh, that's quite interesting. Oh, and it's very easy to be beguiled by these kind of exotic treatments. Most of them have got very little research behind them. They're very crude. I mean, you can make your own judgment on this, but I think you're going to be a little careful. And let me tell you about an experiment which underlies this. So the spontaneous cure rate is 10 to 15%. In other words, they just suddenly get better. And sometimes if we treat one, the others go away. So they did an experiment, I think this was in Germany, with this stuff called Penbode, which is which is an immune stimulant. They found 20 horses. They had one sarcoid on each. They treated 10 of them with the Penbode. 10 were treated with a placebo, which was probably something like saline. So it was injected directly into the sarcoid. And the Penbodes treated 3 regressed, 3 got smaller, 4 no change. And that's 6 out of 10. You think that's pretty good. That's a pretty good treatment. That's 6 out of 10. You know, that's obviously good stuff. What about the placebos? 5 regressed, 1 got smaller, 4 no change. So that was also 6 out of 10. So in other words, if we hadn't run a placebo, we wouldn't have known whether that stuff really made a difference. And this is the problem with a lot of these alternative treatments. So treatment failures then. So here is one that I showed you this earlier. This was treated with topical chemotherapy. I mentioned in the axilla of the armpit, it can be an issue with regrowth. And sure enough, there were actually 2 here. You can only see one. Here they are regrowing, fibroblastic. Again, I mentioned that's how they come back, fairly aggressive. So when a sarcoid is treated and it appears to have resolved, you have to be vigilant for the rest of the life of the horse for them coming back. And if they start coming back, you've got to treat them quickly. Now, this horse was treated with bloodroot ointment, which is purely a caustic preparation. There's nothing exotic about bloodroot. It's just kills every cell it comes in contact with. It contains a compound called sanguinaria, which gives it the red color, hence bloodroot. And it also contains zinc chloride. So basically it just burns the sarcoid off. Very difficult to use because you don't know how frequently you should use it, how much this particular sarcoid is going to take. Anyway, cut a long story short, it did regrow, as you can see in this. It started out as quite a small. It started as a small sarcoid treated with bloodroot, and this is what came back, growing very aggressively, very invasive. We treated that with topical chemotherapy, and before we had the laser, we probably would laser it now, and we got a very good result. And then finally, this whole question of, and I get asked this quite a lot, you know, I'm looking at a horse this weekend, she's told me it's got a sarcoid that's been treated. Should I buy it? Should I even look at it? Well, I think it's fair to say that a horse should never be condemned purely because it's got a sarcoid, because it depends on where it is, how many, is it in an area of tack contact? Has it been treated before? Because if it's been treated before, it's growing back. We know the success rate is for the next treatment, in fact, drops by half. So the answer to the question is, should I buy a horse with sarcoid? Is it depends. So you've got to consider the cost of treatment, which you might, some people negotiate that with the seller. Sometimes I'm asked by the buyer, you know, what's it going to cost to treat that? I give them some kind of estimate and they then go back to the seller. Obviously, I would have to advise on the likely success rate. Is there a risk of recurrence? And then what I call the sarcoid curse. The sarcoid curse is that a horse that has had sarcoids tells you 2 things about that horse. One is that it's got the gene to develop them. And secondly, it's got the sarcoid virus in its body, and it may well get more. So if you do buy the horse and it's had sarcoids, you've got to be vigilant for others appearing. And then, of course, on the pre-purchase veterinary examination, if there's a reference to sarcoids on the certificate, the insurance company will exclude sarcoids for the life of that horse. And that's something will put people off, but it won't put others off. Now, just going on to melanomas then, changing the subject completely, very, very common. And they are a tumor of the black pigment producing cells in the skin. There is a problem with grey horses, essentially. Grey horses have got black skin, and they've got black skin because they've got cells called melanocytes, and the melanocytes become cancerous. and they're very common in grey horses. All grey horses go back to one grey horse. It's a mutation, and unfortunately the mutation also brought with it a predisposition to developing skin cancer in the form of melanomas. And they're extremely common. 80% of greys over 12 years age have got them. They usually affect the hairless area, so we're talking about under the dock, around the anus, around the vulva. Occasionally we see them on other places, which I'll show you in a moment in some photographs. And we can get secondary sites if they spread. They're very slow growing, but they can become huge. They don't commonly become malignant. It's about 1 in 3 cases become malignant, but they're usually older horses that have had the tumors for a long time. They do occur in non-greys, and there is a view that they're more likely to become malignant in non-greys. So if I diagnose a melanoma in a horse that isn't a grey, I want to get that off as soon as I can. So here's a few examples. They start off with these tiny little bumps. You can barely feel them in this region here, around here. And then here's a bigger one. May well have some more under the dock. This horse has got a little cluster here, some small ones, some big ones. Here's one between the hind legs, once again on the black, hairless skin mostly. Here's a bigger one under the dock, and there's a few more around there. And then eventually, if you don't do anything about them, you end up with this sort of disaster situation where they're huge, invading the dock. Horse might have difficulty passing feces, even difficulty urinating. So this is a kind of an extreme situation. They've grown very, very slowly, but they grow relentlessly. And once again, it's a compelling case for dealing with them when they are small. All of those started out as tiny melanomas. We get them in other places. I mentioned this is in the throat region here, where they have invaded the parotid salivary gland. Here's another case. And here is one where they became malignant and have spread. So this is the prescapular lymph node here, which is about 3 times its normal size. In a horse, normally you can barely feel it. In fact, you can't feel it. But this horse, unfortunately, has got malignant melanomatosis and is potentially life-threatening. Other places we get them, here's one on the penis. Not uncommonly, we get them in the corner of the lips, and you have to sort of turn the lip out to see them. And often owners haven't noticed them. But for example, when we do their teeth, we can see these masses on the inside of the corners. So I've seen this surprisingly often. And around the eyes, of course, here's a small one on the upper lid. And here's one actually inside the eyelid. A little melanoma growing there on the conjunctiva. It's unusual, but they certainly do occur around the eyes. So what to do about them? Well, malignancy is uncommon. As you know, in human skin melanomas, malignancy is very common, and they're a major issue in human skin, become malignant, but it's much less common in the horse, but they can grow and expand. And so, benign neglect is one option. Just leave them alone, see what happens. I tend to, over the years, have become much more proactive about removing these. There was a belief somehow, and I regret to say it was believed by many members of my profession in the older days, that if you somehow interfered with these, they somehow got worse. There was never any truth in that. In fact, it was nonsense, really. And so I'm far more inclined now to take these off when they're small. It's very often a single procedure. Laser is very, very effective at removing them. I strongly recommend that. Don't just ignore them. Drug treatment. We used to give these a drug called cimetidine, which was used to treat gastric ulcers in people. I don't think it's used anymore. There were some reports of it being effective. It's never worked for me, and I don't use it anymore. Local chemotherapy can be quite effective if they're in a difficult place, like, for example, that one in the corner of the lips. And there is now on trial an immunological treatment. This is a product called Oncept, which comes from the United States. It's licensed to treat melanomas in dogs. It's a sort of a vaccine. We have treated one case with it. It's too early to say how effective it is. The reports in horses have not been very encouraging, but if you have a horse with malignant melanomas, it may well be your only choice, and it's worth a try. So my take-home messages then, I've sort of galloped over this subject a little bit. I hope you've managed to glean something from what I've said. But do ask us, show us these sarcoids, don't ignore them. We see them all the time. We've got loads of experience and we can answer these questions. Will it get bigger? Will it get spread? Should it be removed? What's the best way? What are the alternative different forms of treatment we can do and what will it cost? And what's the likely outcome and what's the risk of regrowth? So my sort of take-home message really with melanomas and sarcoids is don't ignore them. They all the big ones start out small. Treat them when they're small. You'll have a much better result and hopefully they won't regrow. So I'm going to hand over to my colleague David now. See if I can just
Thank you very much, Kieran, for that excellent presentation. I'm now going to take on the story to speak about, sorry, my computer is flashing up all sorts of things. I am now going to speak about the laser treatment of sarcoids and melanomas. Kieran spoke about both sarcoids and melanomas at length there. But to start off with, we're going to talk about our new state-of-the-art laser diode. That was, of course, the late, great Sean Connery in the 1964 Bond classic Goldfinger, which was the first recorded attempt to remove lumps and bumps by laser. So, what is a laser? Well, the letters LASER actually stand for light amplification by stimulated emission of radiation. Laser theory was first discovered by Albert Einstein in 1916. However, it wasn't until 1960 that Mayman actually produced the first laser. So when Goldfinger was released in 1964, laser technology really was very new. Nowadays, of course, laser technology is commonplace in just about everything that we do. Every time you go into a shop and you buy something and it's scanned with a barcode reader, you are using laser technology. Every time you play a DVD, the DVD player contains a laser. If you've ever been unfortunate enough to be pulled over by the police for speeding, you have been caught by laser technology. And of course, a really important use is in human medicine. It's used commonly to treat the condition in the eye of a detached retina. And it's also used very frequently for treating human tumors. And these can range from brain tumors to skin tumors. And it's really this application of the treatment for human skin tumors that we are really extending for the benefit of horses and using it to treat melanomas and sarcoids. So how does a laser work? Well, light travels in waves, all light does. The distance between the peak of each wave is known as a wavelength. And I must acknowledge NASA for the loan of some of the images which I'm about to use. Each color of light has a different wavelength. And if you look at the wavy lines on the right of the screen, you can see that the red wave at the top of the screen has a significantly larger wavelength than the blue wave, which is the third one down. Sunlight, or light from a bulb, has actually light of many different colors, each with their own wavelength. And when they're combined, our eyes actually see them as white light. Laser light is something which is quite different. This wavy red line represents laser light, Laser light does not occur naturally. We have to produce it artificially. And it consists of these narrow beams which have a very similar wavelength, and they travel together in what is called being in phase. Laser beams are narrow, bright, and can be focused into a very tiny spot, which is symbolized in this image here, this narrow focused beam to a very tiny spot. It doesn't spread out. It can travel very long distances, hence the use in speed cameras and in the sights of guns. And it can focus a large amount of energy into a very small area, which is how we use it in surgery in order to generate heat and to cut through tissue. So this is our new state-of-the-art laser diode, which is proving extremely useful. You can see it's got a very easy to use touch screen where we can adjust the settings according to the particular use that we want to apply for it. If I just use my mouse here, at the right hand side here, this is the actual laser fiber, which is extending off the screen, and then it comes back in through the back of this pen-like structure, which is the laser handpiece. This fiber is a really important part of the equipment. It's a quartz fiber, which is lined by plastic. And you can see at the end, there is a green light shining here. We can actually switch this to either being green or red. We tend to use green most of the time for the simple reason that if we should have to deal with blood, which we can actually seal, we can actually adopt a ligature mode to actually stop bleeding. It's easier to see it if we're using green light. Here we have a few other pieces of equipment that we use in liaison at the same time as the laser. Laser safety is absolutely paramount. Everybody involved with the procedure would wear a pair of goggles to protect their eyes, and we have a sign outside the room, and we lock the door so that people who are not involved with the procedure can't just walk in whilst we're doing it. I showed you the fiber, which is the most important part, and it's actually the piece which generates the light and causes the cutting. Every 5 minutes or so, we actually stop the procedure. We cut off the end, trim off the end with the ceramic scissors, and strip back a little bit more of strip some of the plastic off the fiber to expose some more quartz before we carry on. So we use a dual wavelength surgical diode laser. We have the reason that there are two wavelengths is that we can actually just adjust the components of the two wavelengths for slightly different uses. One of the wavelengths is a 1400 nanometer wavelength, and I apologize, I'm not meaning to blind you with science, but sometimes it's nice just to have a little bit of the background of how these things work. So we have a 1400 nanometer wavelength, which is the optimum for water absorption, and 980 nanometer wavelength, which is the optimum for blood absorption. And we can adjust various settings for cutting. We have two cutting settings that we have, and we also have a setting which we call the ligature setting, which if we were to have some hemorrhage, and some of these sarcoids have quite large blood supplies, and there can potentially be some bleeding, we can immediately switch to a ligature setting to seal the blood vessels and prevent hemorrhage. And that is a real bonus of using a laser for removing sarcoids and melanomas. I will show a few statistics a little bit later on, but there is a low recurrence rate of sarcoids and melanomas after laser surgery. And another big benefit of laser surgery is that there is little post-operative pain and swelling. Some of the other treatments, horses can actually be in a fair bit of pain after the treatment, and at the surgical site, or at the site where there have been topical applications, you can actually get quite a nasty swelling. This is much less the case with laser treatment. Another advantage of laser treatment is over surgical treatment with a scalpel is that there's reduced what we call seeding of sarcoid cells. When you cut around a sarcoid with a scalpel, as Kieran said, there's a risk that the scalpel actually pushes some of the sarcoid cells deeper into viable non-affected tissue and actually spreads the sarcoid. This doesn't happen with a laser. The laser actually kills back the sarcoid cells, and it kills around the margin of the sarcoid as well. So it's a much safer method than the traditional scalpel surgery. It is also a one-off quick treatment. It doesn't involve multiple trips to the vet or multiple applications involving the vet having to attend the horse frequently. So several advantages to laser surgery. Our laser is also used for a couple of other uses. Some of you involved with sport horses or racing may have come across horses that have needed to have what we call wind surgeries for respiratory problems generally affecting horses' larynxes, something like a laser hob day, for instance. And this can be treated and is treated at our practice by means of a laser. Also, those of you who've been involved with breeding mares may have seen ultrasound scans performed by the vet on your horse's uteruses and seen cysts being shown up. These can actually be removed hysteroscopically by means of an endoscope being passed into the horse's uterus. And again, this is something else that we do in conjunction with our peripatetic surgeon, Brian O'Mara, who visits Penbode. So, laser sarcoid surgery. It is the treatment of choice for many sarcoids and melanomas. We do obviously address all sarcoids and melanomas on a case-by-case basis, and Kieran has listed a number of other treatment options, and it is by no means a one-size-fits-all, but we are finding that more and more horses do have sarcoids which are suitable for laser removal. Heat energy in the laser beam vaporizes cancerous cells, leading to cell death around the surgical site. And laser energy is primarily absorbed by melanin, which is a skin pigment, and hemoglobin, which is an oxygen carrying component of blood. And as I said before, the laser is very, very good at actually stimulating blood clotting and hence reducing hemorrhage and bleeding. So I've got a couple of video clips here of the laser being used. This laser is set with a red light at the end. As I said earlier, laser safety is absolutely paramount, with the goggles preventing people who shouldn't be in the room from being in the room. We do the majority, in fact, we do pretty much all of the horses standing under sedation, and you can see that the horse isn't feeling anything at all. We are very careful to make sure that there is adequate pain relief given to the horse. We give them an injection of often phenylbutazone in the vein, bute, and then a short course just for a few days of bute afterwards to prevent pain. We also use local anesthetic injected around the sarcoid, and so when the actual laser is cutting or in effect burning through the skin, the horse really feels absolutely nothing and stands stands very still. In some circumstances, it may be necessary to do a general anaesthetic, but in our experience so far, that is pretty rare. We make sure that we have taken what we refer to as a good margin around the outside of the sarcoid, which basically means we make sure that we've definitely got all of it, or we do our very, very best to ensure that we've got all of it off. And this means at least 1 centimetre around a sarcoid, and on occasions it might be 2 centimetres. And as I mentioned earlier, there is this ligature setting, which with certain sarcoids with very good blood supplies, large blood vessels into them, we really do need that ligature setting, which is just pressing a button on the laser to make sure that we can seal any hemorrhaging blood vessels. The wounds are left open to heal. We refer to this as second intention, and it will take somewhere between 1 to 2 months, and we are finding that 2 months is probably an optimum time for complete healing with some of these sarcoids and melanomas, but they do heal incredibly well. We like to send the sample that we remove to a laboratory to be analysed, a process called histopathology. And this is for a number of reasons. Firstly, as Kieran showed, there are several different types of sarcoids, and the type of tissue that we remove can vary the actual prognosis, the chance of a recurrence. So it's nice to have an idea of that. And also we can tell whether the margins are clear or not. So sending away for a laboratory examination is something which we would strongly advise. Now, I've got 3 cases which I'd like to share with you. These are 3 horses that Kieran, myself, and our colleague Hermione Jane have worked on and removed by laser at Penbode over the last 2 months. The first one was a 10-year-old chestnut thoroughbred mare with a single nodular 3 centimetre sized sarcoid, which was inside the right thigh. So here we have a sequence of photographs, the before and the sequence of the days and weeks after the surgery. And you can see along the top row there that after surgery, up until about 6 days, the wound, which was basically an open wound, filled in with this pink tissue, what we call granulation tissue, and it began to just get this white rim around the outside, which we call epithelial cells. And the process of the wound beginning to contract down is called epithelialization. And this is standard wound healing. This would be the same as if your horse cut itself with barbed wire and you just watch the wounds contracting down. It's the same natural healing process of the body. Something that we have found really quite consistent, and speaking to colleagues with a lot of experience in different practices around the country, I think we're finding consistently that between about 7 and 14 days after the laser excision of sarcoids, that the wound goes through a period where it looks worse. So it stays looking, it seems to improve visibly for about 6 days, and then from about 7 to 14 days, there seems to be this dip period where it is normal for it to look worse. And at this point, we have to do quite a lot of reassuring to the owners and the clients that this is normal, not to worry, not to panic, because actually, once we get through this window, the process will get back to looking visibly like it is improving. And this is exactly what happened with this sarcoid. And actually, I was talking to the owner, I was talking to the owners of all 3 of these horses over the last few days. And now we're 2 months down the line, and this is pretty much completely healed. There is just a fairly small scar left behind. So we're on to another case now. These are perianal melanomas, which Kieran showed some pictures of in other horses. This was an 11-year-old grey Irish sport horse mare with 13 perianal and dock melanomas, varying in size, some really little ones, only 0.5 centimetre, some much bigger, 3 centimetres. But yeah, it probably was concerning that this is an 11-year-old horse with already this number and a few quite large melanomas, and it probably was a worry that how these were going to progress and how the horse would look when it was getting older. So we performed laser surgery. Here is the surgery in process. There's local anesthetic put around the melanomas, as we described before, and tissue forceps being used to help lift the sarcoid up as we're working around the base of the sarcoid. And here we have a sequence of shots taken immediately after the surgery, which is over on the left. It probably does look quite dramatic, doesn't it? There are 13 holes there where the 13 melanomas were removed. However, these do recover extremely well, and we go through this process of granulation where new tissue grows where the holes are, and then epithelialization around the outside, and then gradually contraction down to leave us with just some small scars. And again, we're now with this horse about 2 months down the line, and there really is very little healing left to be done. They've basically just left with a few scars. Interestingly enough, if you notice day 10, that this image shows the wounds at their worst. And we all have to remember that this is natural. This is normal. This is part of the normal healing process, just to go through this excessively weepy phase before we get into the more aesthetically pleasing healing phases after that. I've got one more case just to describe, just to show you. This was actually the largest sarcoid that our team at Penbode have removed. It was quite a challenging one, really, because this was a big sarcoid. This was 15 centimeters in diameter, and it was fibroblastic. There was a lot of bleeding. The history to this was that there would be a lot of bleeding. You can see blood, congealed blood on the outside of the sarcoid, and intermittently it would bleed quite badly. Because there is such a big blood supply to it. And around the base of this fibroblastic sarcoid, there was quite a wide occult flat sarcoid area, which we had to remove as well. So we removed it by laser. There were, as I said, 2 pretty large blood vessels there that we had to carefully ligate with the ligature mode. And it is doing really well. Again, I know this owner very well. I've known them for many years, a very experienced horse person, and I explained that there was going to be some discharge, and around the 7 to 14 days, it was likely to look bad. And if anything, this owner told me that they thought it wasn't as bad as they thought it might be, and they were pleasantly surprised that it wasn't as bad as it might be. But it certainly, they're not pleasing to the eye at that 7 to 14 day stage. However, this photograph here was actually taken over this weekend. It's very current, and you can see on the far side here at day 34 that we've got this granulation bed. This is healing really nicely with this white rim of epithelial tissue around the outside. And this, we're only a month down the line, and I think for such a very big and such an aggressive sarcoid, we're very pleased with the way this one has been progressing, as we are with both of the other 2. So there are some published results about this process, about the use of laser surgery. There was a big study done by the team at Rossdale and Partners in Newmarket, which is the practice that I used to work for before I came back to Penbode. I came back to Penbode in 2005, and this the team that published this paper was led by my former boss, Richard Payne, one of the partners there. And in this study, they showed that 99 horses were actually treated by laser surgery, removing a total of 235 sarcoids. So this is a very big sample size, a very big study. And 83% had no recurrence of the sarcoids removed. So a pretty, very, very good success rate, really. And there are a few other of the sort of conclusions and outcomes that came from that study is they found that sarcoids on the head and neck and varicose sarcoids were an increased chance of coming back. But laser resection of the sarcoids had a very positive post-operative prognosis. So a very credible technique with some published data, scientific data to actually back it up. So just to recap, the advantages of lasering sarcoids. There is a low recurrence of sarcoids. I say a published study showed 83% success rate. There's a reduced seeding of sarcoids into the surrounding tissue. Laser doesn't push sarcoid cells further into the tissue. It actually burns them back and prevents that. We can be very, very precise with this focal beam of a sarcoid to make sure that we are removing all of what we want to take out. Our ligature mode actually means that we can reduce bleeding and reduce hemorrhage quite easily. And also, this is a relatively pain-free post-operatively, which we're still really quite impressed with how well these horses do after the surgery with minimal post-operative swelling. And it's a quick one-off procedure. It doesn't involve multiple visits. And as I say, we sedate them, use pain relief, and certainly it's a shorter procedure than many others. So in conclusion, laser resection is an effective first-line treatment, probably for most melanomas and sarcoids, although I must say that we do judge them all on a case-by-case basis, and we do still use other treatments for sarcoids where appropriate. I would like to just say a big thank you to a few people who have helped me with lasering and with the preparation of this talk. I'd like to thank Brian O'Mara, who is our peripatetic visiting surgeon at Penbode. Brian has been lasering sarcoids and melanomas at Penbode for many years before we actually got our own state-of-the-art machine. Also to Russ Parker, who's one of the surgeons at Penbode Equine Hospital in Hampshire, who's been extremely helpful and supportive over the last year or so. Also to my former employer, Rich Payne from Newmarket, who has probably taken off more of these sarcoids than just about anybody else in the country. And of course to NASA for the loan of their pictures earlier on in the talk. Thank you very much for your time. And I know that Meg has been collecting together some questions. If anybody does have any more questions, please pop them on the chat line. And now I think Kieran and myself are going to be available to answer any questions that you have.
Hi everyone, I'm Meg. David, I think you just need to stop sharing your screen if you can.
Okay.
Perfect. I'm one of the other equine vets at Penbode, so I'm just going to take some of your questions. We've had quite a few questions coming on chat and through email, so we might not have time to do them all, but I'm going to take some of your questions and pass them to David and Kieran for them to answer. So first off, we had a question: can you tell if a horse has had a sarcoid in the past, i.e. does it leave a scar?
I'll take that one if you like. It's obviously something that is really important at vettings. Very careful to examine the groin region of the horse to see if A, if it's got sarcoids, or B, if they've been removed. Sometimes the scar can be very, very small. It does depend on the size of the original sarcoid and to some extent how it was treated. It's likely the laser would probably leave a very small scar, whereas topical chemotherapy would probably leave a much bigger scar because it tends to kill off a much wider area. So the answer is they can be very, very subtle and hard to detect. But hopefully we will spot them in most cases.
Okay, great. So second question. I know both of you touched on this a little bit, but does the site of the sarcoid affect the treatment options available? So the person who asked the question used the example, a sarcoid on the lateral aspect of the carpus, which is quite near the joint. So does it limit surgical or laser options? I think this particular example is currently being treated with chemotherapy, but it's getting bigger.
David, would you like to answer that one?
Yeah, sure. The site does affect treatment options. Yes, very much. I mean, from a laser perspective, we are wary of sarcoids which are close to the eye, and we would be wary of doing them around close to joints as well. And there are some much more sort of site-specific treatments. I don't know if Kieran, if you alluded to that in your talk. I don't know whether you want to just describe.
I mean, joints are always a worry because particularly on the leg where they're just covered by a fairly thin layer of skin and you're directly onto the joint. So, I mean, and certainly in some cases we probably could laser sarcoids close to joints. It depends how easy it is to lift them off and get them clear of the joint, that sort of thing. But there are other options in those difficult places, radiotherapy being one, BCG treatment is another, particularly around the eye. So, you know, there are times when the laser is not the best idea, but I think we're using it increasingly now. We're getting more used to it and understand its limitations and its uses.
I think what we don't really want to do is to promote a one size fits all, and I think that each of these horses needs to have a thorough examination by a veterinary surgeon, because there are so many variables, such as that person has just pointed out, that there are structures like joints, like the eye, where we would be wary. We're also wary of being around sensitive areas like the penis. We're also wary about large blood vessels, and I think that a thorough clinical examination by a veterinary surgeon before and a discussion with the owner over the pros and cons of different treatments. As Kieran said, having said that, we are finding that the laser is appropriate for probably the vast majority of sarcoids that we're seeing at the moment.
Okay, great. So another one, someone's asked what you would advise for melanomas on the neck.
David?
Okay, I mean I think that is quite a tricky one, and that would need to be assessed on a case-by-case example. That is one that we would probably be cautious about using the laser on. We use the laser very much for melanomas on the perianal region. I think that's a very appropriate place to do it. On the neck, I think we would have to judge the size of the melanoma, the exact place. You know, there are some very important structures, particularly in an area called Viborg's triangle, where there are some very major blood vessels and nerves running in that area, and we would be extremely cautious about operating in that area. I really think we would have to look on a case-by-case basis. I don't know if you want to elaborate more. You mentioned some of the other oral treatments, Kieran, in your talk about melanomas generally. I don't know whether you want to elaborate on.
Yeah, I think that the basic principle applies. It depends on the location. If it's directly over the muscle on the neck, would probably be fairly amenable to laser resection. But if it's sitting over the jugular vein and there's some very important nerves under there, we probably would be quite wary in that region. As David says, also in the Viborg's triangle, which is in the top of the neck by the angle of the jaw. So they're all different and they've all got to be assessed individually. And one size doesn't fit all.
I think the lady's just added that it's on the inside of the neck, like on the gullet area is what she said.
Well, that's a tricky area because you've got a big jugular vein there. You've got a very important nerve runs down next to the jugular vein. So that one we would have to assess very carefully and decide if the laser is the right thing for that one.
Okay. So there's been a couple of questions. I'll sort of combine them into one about the wounds, post-op wounds of the laser. One person's asked how easy it is for them to become infected, and another person has asked how sort of clean they should be kept and if any topical treatment's necessary.
Really good questions, and I'm glad that they've been asked, actually. One of the things that I probably didn't say in the talk, and I should have done, is that the laser actually does leave a sterile site. It's another one of the advantages of it. And post-operative infection the chance of that is extremely low. When we first started doing these, we used to put the horses on post-operative antibiotics, and we used to use a topical antibiotic cream. We actually don't do that anymore. And talking to colleagues working in equine hospitals, reputable equine hospitals around the country, a lot of guys are not giving post-op antibiotics because the chance of infection is very low. Sorry, does that answer the question, Meg, or was there more?
Yeah, I mean, there was someone just asking how easy it is for them to become infected. So I think that answers it quite well.
Yeah, it's quite certainly in our experience and talking to colleagues, we leave a sterile site, and post-op infection is not a common complication.
Yeah. Okay. Thank you. Again, Kieran, you touched on it earlier, but someone was just asking how easy it is for sarcoids to be transferred from horse to horse by the stable flies.
Well, they've done experiments where they have allowed stable flies to feed on sarcoid material, and they're able to show that the virus can survive in the fly for something like 12 to 24 hours. So potentially that fly then biting another horse in the same barn or stable block could transmit it. But of course, it does require the recipient horse to have the gene, and there's a 50% chance it hasn't got it. And also, of course, that some of them will mount a pretty effective immune response. So the transmission is very unpredictable, and it certainly does occur. And undoubtedly, stable flies are probably important, but obviously other flies as well.
Okay, great. So we've got we've had quite a few questions. There's one here about the success rate for laser treatment. So they're saying if it was 83% after 5 years, would you expect sort of more recurrence of the sarcoids in the first 5 years? As you said, they could reoccur up to 10 years after treatment.
Yeah, it's interesting. If I'm remembering it correctly, in the paper I quoted, they were talking that if you were that the majority of horses, if you were going to get recurrence, it was actually within the first 6 months. So a lot of these horses say if you can get through the first 6 months, there's a very good chance you're going to get through the next several years.
When I said 10 years, that was a kind of an extreme example, really. The vast majority, as David says, will occur, as he says, in the first 6 months or the first year. And that's why, as I said, you've always got to be vigilant. Where a sarcoid has been removed, you've always got to watch, is there anything growing there that shouldn't be there? And then if that's treated promptly, when it's small, you should have a good outcome.
So I think probably one of the last questions. Someone's asked, they've recently bought a horse with a sarcoid. They didn't have the horse vetted. Can they send the horse back?
Well, that's a sort of consumer legislation issue. I'll give you my amateur interpretation of that. If the horse was sold by a private sale, the only legal protection is misdescription. So if the buyer asks the seller, does it have sarcoids? And the seller said no, and you've got evidence that they said that, well, then in principle, you could return the horse because it's been misdescribed. Now, if you're buying from a dealer, you are protected by the Consumer Rights Act, which means the horse has got to satisfy 3 tests. First is that it's of what's called merchantable quality, that it's as described and it's fit for purpose. And if it doesn't satisfy any of those 3 things, it is potentially returnable. So of merchantable quality, is a horse with a sarcoid? I suppose it depends on where it is. You know, that could be argued, that would be argued in court. Fit for the purpose, is it going to impair its usefulness? Well, it certainly would if it was in an area of contact. And as described, well, if it was described as being sarcoid free, and that specific issue was addressed in the description, and you have a record of that. Fortunately, all of these things are verbal and people don't have records of them. You know, if it's misdescribed, you do have some legal redress. But I emphasize, I am not a solicitor and I am not an expert on consumer law, but that's my understanding. But I think it's important that you realize, and there's a bit of folklore in the horse world, that somehow a horse with the sarcoid is automatically returnable. It's rather like a horse with windsucking is automatically returnable. Well, it's not. In neither situation is it. And you just need to be careful and ask the right questions and keep a record of the answers. Really important.
Okay, great. Right, just one final question. So someone's asked what the effect of lasering one sarcoid would have. Would it have an effect on other sarcoids on the horse?
Would removing one sarcoid actually affect the sarcoids that then stayed?
That's what they're asking. Yeah.
Yeah. Well, that is a difficult question. I think that probably not is the answer to that. I think it would actually affect. It would obviously remove the one sarcoid, but obviously those sarcoids that were still there could remain. They could get bigger, or they could spontaneously regress. You know, and Kieran alluded to some sarcoids will just spontaneously get better, and it can be attributed to a treatment. But I think what this comes back to is actually assessing each horse individually and making a treatment plan for that particular horse. And if a particular sarcoid was particularly problematic, then you would definitely remove that sarcoid. And if you can remove the others, then you would remove them as well. But I think it does need, this really just comes back to the need for a vet actually to see the animal and to make a treatment plan based on the individual.
Great, thank you. I think that's the majority of the questions answered. I think that's all we've got time for, really.
Okay.
Pass it back to you, David.
Yeah, well, thank you very much, Meg, for asking that. One thing that we haven't mentioned is the actual cost of sarcoids, of the laser treatment and other treatments. I think that it's difficult to answer that question because it does vary very much on the actual site and how difficult it's going to be, the length of time and the treatment that's going to be used. And I think that the cost can be really quite variable. It can vary from a few £100s, which is where it starts, but for very involved sarcoids in tricky sites, it can be significantly more than that, as can any sarcoid treatment. So I think if any of you are concerned about your sarcoids, the best thing you can do is just have an appointment with your vet to assess them, and an individual treatment plan can be arranged, and a cost estimate can be given. But yeah, no, thank you very much, Meg, for that. I'd like to thank Kieran as well for his excellent presentation. I'd also like to say a big thank you to 2 people who've helped us behind the scenes setting this up. We are, I don't mind admitting that Kieran and I are a little bit out of our comfort zone. We've both given a reasonable amount of public speaking over the years, or done quite a lot of public speaking. We've never done something virtually with no immediate audience feedback to gauge how things are going. So thank you very much for your time, and thank you very much for for listening. The two people who've really helped us have been Katie Stanlake, who works here at Penbode, and a friend of ours and a friend of the practice, another vet, Malcolm Morley. I really hope you've enjoyed this evening. We would value any feedback that you have, even if it was, David, you spoke far too fast at the beginning, you know, which I know I did. So if you can any feedback you have about the subjects, or about anything that you would like us to present to you again in the future. Thank you very much, and good night.